What's your name? Okay. Yeah. Oh, good. Oh, thank you. I appreciate your support. Okay. Hello, hello. Thank you so much for supporting. Thank you for being here. Hope you guys are doing good. You're in nursing school? Oh, okay. Almost done or halfway there, kind of? Nah. Yeah. All right. Cool beans. Maybe I probably need to okay, so let's go over the reasons. I'm gonna go straight into it. And I'm actually gonna do like a recap video I did. And then I'll go into the other reasons that I laid out. So, so just to kind of give context, one of the things I've noticed is I have talked to a lot of people on the phone. Like, since I started doing this in 2015, but it was in 2016 where I started doing phone consultations. And I wanted to essentially I wanted to better understand why people weren't passing the NCLEX because I I grew up the school and the program that I went through, it was normal for everybody to pass. And so I realized I had to talk to people one on one to better understand what their hurdle was and to listen to each unique scenario, and listen to every stipulation, challenge, setback they were experiencing. And I realized there's so many different scenarios or so many different factors. And the ones I'm going to share though, these ones I'm going to share right now are things that you can control. So they're things that's within your ability to control. But other things I've noticed in the past were things like, for example, the school they went through, the education that they got, like that. Just different things that really made a huge difference. So I'm gonna go over 7 different things that I've noticed, and from just talking to probably at least 1,000 people now that have told me I can't pass my test and I don't know why. And I know, yeah, questions can be confusing, and it could be because of how the question is worded, or it could be honestly the way that you interpret questions, period. And so yeah, so I just want to better understand, okay, like how are people seeing the test that's interfering with their ability to pass. Okay, so let me go over what they are with you. Hi, I can see you on here. Comment below. Okay, all right, so let me go over what they are with you. I want to here, let me see if I can try this while I'm on here. And yeah, sorry, bear with me 1 second. Okay, let's see if this will work because I was supposed to conference call. Okay, there we go.
Welcome and thank you for choosing freeconferencecall.com. Okay. You're helping people around the world communicate for free. There is one other participant in the conference.
Okay, great. Okay.
Please announce yourself.
Thank you for coming in. For those on the conference line, give me 1 second. I'm gonna adjust the settings because this is really loud. Okay. I turn on the recording. Blah blah blah. Okay. I think this is working now. Let me just lower the volume because this is like super loud. Okay. Sorry. So I'm live on 3 different places. That's the reason why like it's taking me so long, because I'm trying to multitask. Okay, but I promise I'm here with you. Okay, I'm here with y'all. All right, so let's go into what are the 7 different reasons that may be hindering you from passing your exam. So the first one, number 1, is going to be lack of the right skills. Okay, lack of having the right skills. Hi, I see you. So what I mean by this is that I'm going to go over what the skills are. And I'm so fortunate because I've been able to, when I spend time with people, like I listen to how they look at questions. I listen to how they study, what they've done, what they haven't done, everything they tried. Like I really try to listen, and then I try to spend enough time with people to figure out what the source of the problem is. And some people, when I talk to them the first time, boom, I'm like, oh, it's this immediately. You need to do this and this. And then some people, because it's so complex, like based on their history, especially if they've been out of school for a long time, I'm like, okay, I need to keep working with you until I figure out, until you go into more depth as far as why you're not passing your test. Okay, so these are some very specific skills that I've noticed that people that don't pass struggle with. The first one is deductive reasoning. Deductive reasoning. And I sent out, for those that are on our email list, I actually created a PDF file. So if you're watching this and you're on our email list, thank you for watching. And the file, I went over all of the 7 things. Hold on, let me stop this person. Okay. So I went over the 7 things in the file. So if you want to download that, if you put people that are on here that's listening to it, that have that. Okay, so the first one is deductive reasoning. So deductive reasoning is a logical approach where you progress from general ideas to specific conclusions. All right, oopsie. Where you progress from general ideas to specific conclusions. So what that means is that you're able to look at something. So if you check your email, if you're on our email list, I sent it out to everybody this morning via email. So if you're on our email list, you'll get it if you're on our email list. If you're not, join our email list and then I'll resend it again. All right, so deductive reasoning is a logical approach where you progress, and you can join our email list by going to the link in the bio, where you're able to go from general ideas to specific conclusions. So what does that mean? So what that means is that you're able to look at something and then be able to lead to a conclusion that gives you the answer. So so the issue I see for a lot of people is that they're not strong in this area. So meaning that like you'll read something, but then it won't necessarily be where it leads you to the right conclusion or the right understanding about whatever you read or learned or etc. So when somebody has strong deductive reasoning skills, they're able to assess and then identify and then conclude and make certain conclusions that are usually correct. So if I was to give you a really simple example, like a really simple example, and then I'll give you a hard example, that would be Tom. Tom loves dogs. Tom Tom promised that when he turned 16, he would buy a dog. Tom just turned 16 yesterday. Boom. Which of the following would you anticipate Tom to do next? Right? So obviously the answer would probably be he's going to go and buy himself a dog, right? So that's a very easy and obvious answer as far as making those conclusions, but then when you swap out Tom with like a medical diagnosis, okay? Swap out birthday with a sign and symptom, right? Swap out dog with an intervention, then it becomes more difficult. See that? Then it's more challenging when you substitute for those different words and different languages. And essentially when it comes to the NCLEX, especially with the upcoming next gen NCLEX, that's what they're doing. That's what the focus is. That's what the goal is that with the next gen NCLEX, with the case study questions, and from what I'm learning, it's not all case study, but the case study questions, um, it's going to give you a scenario, and then you have to be able to break it down, and you have to be able to choose the best answer based on all the information. But it's not just like multiple choice. Now it's instead, okay, um, here's pull down menu questions, or pull down menu answers. Here is identify if this is essential, non-essential, or most essential. So it's now different where like you have to be able to use deductive reasoning to lead you to better conclusions, right? So when you learn how to look at something and then come to a stronger conclusion. Hold on, I'm not recording this.
The recording has started. Please note that your storage is almost full.
Okay.
Please log in and delete recordings or purchase more storage from your account.
Okay. So essentially, that's what deductive reasoning means. Okay. So that's the first thing is deductive reasoning is a logical approach where you progress from general ideas to specific conclusions. So you got to build that skill up, and when you start to do that, you'll get better. And you can read books on deductive reasoning. Like you can watch videos on YouTube on deductive reasoning, but you want to work on that as well. The second thing, the number 2, is abstract reasoning. So abstract reasoning is most closely related to fluid intelligence. This is our ability to quickly, thank you for following. It's our ability to quickly reason with information to solve new, unfamiliar problems independent of any prior knowledge. It includes lateral and flexible thinking, logical reasoning, and generating solutions beyond the most obvious. So, I remember when I was in nursing school, and up until nursing school, I was really good at whatever, I could study something and boom, oh, A plus, A, like, as long as I put in the work, I would get the results. But it wasn't until I got to nursing school where I couldn't do that anymore, and it just didn't work. And essentially, what I had to do, I had to learn more concept reasoning, abstract reasoning. I had to understand things that's more conceptual, things that's not as tangible. And so that's one of the challenges with nursing. That's why nursing is more difficult than like other types of topics like English or basic math, because there's different layers, there's different steps to comprehending nursing. So for example, even if you understand type 2 diabetes, before you can understand type 2 diabetes, you need to understand how the pancreas works. You need to understand the cells in the pancreas. Then you need to understand what insulin does, and etc. So type 1 though is with the damage of the beta cells. But the point I'm trying to make is that you have to first understand a concept before you can understand something else, and then something else, and then something else. So it's like there's layers to your ability to fully comprehend a topic. And that's why it's more challenging, because you're often trying to look at everything from a place of like a linear focus, like where you're just trying to memorize and regurgitate, but you often won't remember the information that way. Like you're going to, it's not gonna click. It's gonna be hard to retain if you are only trying to memorize and regurgitate. You have to truly understand the bigger picture. That's why essentially before you take med surge, they take you through a process. Like ideally, when you go through a nursing program that's really strong, you first have to learn, organic chemistry and microbiology and biology, like all these fundamental topics, which plays a role in you really understanding med surge. So the issue is that when you've been out of school for a certain amount of time, you forget about all of that stuff. And then in addition to that, you forget to learn it, right? You forget to go back and study it. And that's why it can feel like you're studying, you're doing resources, you're doing practice questions, and you're still not getting results, because there are fundamentals you still need to work on. And that plays a role with your abstract reasoning. Does that make sense? So I hope that's making sense so far. All right. Then the next thing, number 3, is cognitive reasoning, right? So cognitive reasoning is different from abstract and deductive reasoning. Cognitive reasoning is your ability to analyze and perceive any given information from different perspectives by breaking it down into manageable components and then putting it in the correct order. All right. So in a nutshell, cognitive reasoning is where you're presented with information and then you put it in the right order. What does that sound like? That sounds like drag and drop questions on the NCLEX, right? Where it tells you something and then you have to put it in the correct order. So oftentimes, like the different ways that you can test your cognitive reasoning is to do like puzzles, like aptitude tests, like things that forces you to put stuff in an order. That's how you can begin to work on your cognitive reasoning skills. And when cognitive reasoning is associated with an individual's ability to analyze information quickly. So remember, because the test is timed, because there's only a certain amount of time that you have, it's also about your ability to analyze information quickly with clarity of thought and the ability to ignore, here it is, unimportant details. So cognitive reasoning is two things. It's where you can put something in the right order, one, and it's also your ability to be able to ignore what's relevant and what is not relevant, right? So for example, with the next gen NCLEX, one of the format of the case study questions is that it will give you like a whole nurse's notes and like all these vital signs, all these signs and symptoms, and then it would ask you, okay, of everything it told you, highlight what's actually important. And it's like a long paragraph, right? So highlight everything that's important. Pick which of these are actually essential and which of these are not essential. That's cognitive reasoning skills. So for you to be able to do well in that, like you have to work on that. You have to train your mind to put things in the right order. You have to train your mind to recognize what's relevant and what's not relevant based on how well you understand the topic, right? That's why it's not enough to just do a bunch of practice questions. You have to actually like really understand the information for real. So for example, let me give you I just have a really good funny example actually. Let me give you a good example. Okay? For those of you that watch oh really? I passed the NCLEX in 2015, but I still listen to your lectures. Very informative. Thank you so much. Oh, see another person that passed their test. Thank you for sharing your comment. I appreciate it. Okay, I hope you're enjoying your career now. um, so think about this. Think about this, like what I just said right now about cognitive reasoning, about, like I said, your ability to ignore unimportant details. Thank you. So here's the thing that's really interesting. How many of you, well, maybe not some of you, but how many of you watch the show Friends? Right? Friends, like, do you guys watch that show? I think it's hilarious. If you don't watch the show, then this is not going to make as much sense. But I will give another example after I say this example. If you watch Friends, put yes in the chat box. If you watch the show Friends, yes, I do, or yes, I watch that. Well, there's an episode where Rachel is making. God. Okay, there's pretty much like an episode where Rachel is making. She's pretty much making like some type of dessert dish, right? And she's making this dessert dish, and in the dish she puts like all these random, she puts like pretty much all the correct ingredients except for like one or two that was incorrect. She put in like it was some type of 7-layer cake, and custard, whipped cream, strawberries, but then she put like beef in there and something else that was like really like, and pickles. And so it wasn't until after she made the dessert and people ate it at the Thanksgiving dinner, and then she was like, "Oh, I was not supposed to put beef in the dessert," And so she didn't realize, like, duh, why would you put ground beef in a 7-layer pie, right? But so that was obviously a lack in her cognitive reasoning, because she didn't realize that adding ground beef was not an essential detail. It was not a relevant detail. So that's why she did it incorrectly, right? So that's what I'm trying to give you an example with that. So like in the same regard, as far as like if you were, let's say, baking a pie or baking a cake, and sorry, if you were baking a cake, right, and let's say when you're baking the cake, you pulled out a recipe book, and the recipe book, it told you, okay, add eggs, flour, milk, water, and then it said, and add vinegar, right? If you have cognitive reasoning skills, you'll be like, vinegar, like that doesn't sound right. Right? That's inappropriate. Like, I'm not gonna add that. Let me double check the recipe for real, right? So that's an example of cognitive reasoning as well, where you can receive a bunch of information and then recognize what's actually important and what isn't important. And that's how it is with the exam. It's like it will tell you a question, and then sometimes it will give you too much information in the question, or sometimes it will tell you the question and the choices will tell you too much information, right? But if you understand diabetes well, if you understand cardiac catheterization, if you understand heart surgery, and etc., you're going to know immediately, oh, that's not appropriate for this, that's not relevant for this, right? So that's the example right there of cognitive reasoning. Is that making sense? If it's making sense, put yes in the chat. Let me know. Yes, I'm following. Yes, it's clicking. I'm getting it. Okay. Let me know yes if you're following along. All right. So those are the first three things, right? Yes. Okay. Good. Thank you. Awesome. Glad it's making sense. Okay. So the other thing too. Good. Awesome. The other thing as well is going to be down here. Language barrier. All right. Yes. Okay, good. Thank you for commenting. Language barrier. So you need to have as well, if English is not your first language, then you have to dedicate some time towards spending reviewing medical terminology. Okay. If English, I'm saying one more time, if English is not your first language, then you should dedicate some time reviewing medical terminology, because there are certain elements or certain things that you have to kind of expose yourself to. Hold on one second. Okay. There are certain things you have to expose yourself to, so that way things make a lot more sense to you. Okay. So you have to spend time with learning. I was just working out with one of my students yesterday, and I was talking about this with her, and we were going over, okay, now what I want you to spend time. Oh, yes, okay, good. Thank you, Jamie. I just saw your comment here. Okay. I want you to spend some time now with going through medical terminology, because you need to kind of strengthen that area, because it's going to help you to better break down the questions faster. So one of the things for a lot of people is that it takes them a long time to break down questions, because you need your terminology. You need to know, like, for example, let me give you an example. This is going to be prefixes and suffixes. This is going to be identifying the root words, root meanings of different types of words and languages. So I could be talking, for example, I could be talking about ectomy, or what's another example? Like ectomy, which usually means to remove something, or itis, which usually means inflammation. Of these are all examples simply of like prefixes and suffixes. Okay? So when you begin to spend time with like learning like medical terminology, you'll be able to break things down faster. One of my students that passed her exam after being out of school for like several years, and after she passed her test, I interviewed her, and one thing she told me that helped her a lot was her ability to go back to look at the question and figure out what a word meant, like a prefix probably meant, and that helped her to eliminate the best choice. So that's one thing that you have to work on too, is that you gotta dedicate some time to looking at medical terminology. And you can find like books on medical terminology. You can honestly, like, you can find so many books. You can go online and like just Google medical terminology. One thing I'm gonna work on too, because I realized like I need to create this for students, is a medical terminology book. It's like just create one as well, so it's easier for you guys. But you can go online, you know, because it's going to really help you. All right, then the next thing, all right, let me see, I think I said, what, four things so far? Okay, so now I will say that this one, number five, it doesn't apply to everybody. It doesn't apply to everybody, because I know a lot of you are honestly very determined. But once again, remember, I've talked to like almost 1,000 plus people now over the phone. And so one of the things I noticed too is like just not having strong resilience, as far as taking this task, not having strong enough resilience. And nursing is not easy, right? If anybody told you, oh, this is the easiest career ever, like you're gonna get in like a breeze. If people are flaunting to you like it's not hard at all, then they're lying to you. Like, maybe they got lucky. I don't know. But for me, I went through so much just to become a nurse. Not even like after I actually got the license. And the process is not easy, right? Like, as soon as you'll be convinced that because it's difficult for you, it's abnormal. But it's not the case. It's hard for everybody, most everybody. And so the thing about it is that, like, you have to persist. You have to persist. You also have to do things with wisdom too, but you have to persist. I can't tell you how many people that I talked to, and man, they were so close to passing. But what happened is, like, so many things happened. Either um, they got like near passing all the areas, and you know what? They got so discouraged they took off several months. Like, they took off several months, maybe a year. And the problem with doing that is that now you lose all that momentum, and it's like starting from scratch, and it's way harder when you take so much gap. You know, if you need to, like, don't try to limit your social media, as far as, like, not on here though, because you need to watch these videos. But if you need to, try and limit the amount of time you're on here on social media, so that way you're not influenced by, oh, so and so just got a new car, and so and so just went back to school, and so is a nurse practitioner now. Like, don't look at all that stuff if it discourages you so much, but you have to be willing to push through and fight for your license. Fight for your dream, fight for your goal, right? You didn't come this far to quit right now, right? You did not. Now is your time. Now is your season. This is a perfect time to get started and to really, like, go at it hard, especially before the new gen even gets here. And nursing is such an in-demand career. I never, ever, ever, if somebody had told me 10 years ago that nurses would be making $5,000 a week to be an RN, not masters, nothing, no, an RN, I would have been like, no, you're lying. Like, get out of here. You don't know what you're talking about. That's not even possible. Like, that's how I would have responded, right? But there are nurses that are literally getting out of debt in like a year just because of how things have changed. And I know there's burnout, I know there's shortage, but that's always going to be there. There's no perfect career. Things are going to be tough no matter where you go, right? So you have to have that resilience. You have to be willing to push through despite everything. Look at testimonials. Look at other people that's been successful. That's why on our page I put, like, there's like a link where I put testimonials on here, and literally it's like so many videos and content, audios of people who have passed their exam, and it encourages you, it motivates you, right? I had one student who, honestly, she took her test 10 times before she passed the 11th try. Like, it was crazy, right? And I remember when I talked to her, I was like, wow, like, I'm inspired by listening to you. I was like, I'm like, you inspiring me right now, because 10 times is a lot of times to take the test over and over again. and still keep having that same energy every single time. But you have to persevere. You have to really believe, like, that it's supposed to happen. It's just all about what do you need to learn so it does happen. All right, number six. Number six, the sixth thing is unrealistic expectations. Okay, unrealistic expectations. Let me tell y'all the truth, okay? You can absolutely pass your test in 8 weeks or 6 weeks. You can do that, but it's the chances of that happening is not extremely high if you've been out of school for at least a year, 2 years, 5 years. And most people that come to me have been out of school for at least 5 years or longer. So like you can't, no, it's not feasible to set that expectation for yourself. And so the issue I discovered is that a lot of times with people, um when they have those expectations, then it doesn't happen, then that once again they get disappointed, they get discouraged, and they give up all completely. But you have to have the right expectations. You have to really see things differently. So for example, one thing I usually tell people is to anticipate 3 to 6 months before you pass your exam. 3 to 6 months of consistency. Every person varies, but it's because there's different things that they did. Let me give you an example. One of my students that passed her exam, Corinne, she passed. She was out of when I talked to her. She'd been out of school for at least 8 years, and then I worked with her and everything. She passed in 2 months, but the thing about it is that she didn't have any kids. She was single, and she studied about 25 hours a week every single week, right? So there's different factors that play a role, but other people, if I talk to somebody else, like, no, like, you're not going to pass it with that's not going to be as realistic, right? For other people, instead, it's going to be um, more time, like it's like, or less time that they have to give per week. So most people, they have a job, they have a career, they have kids, they have other things going on. So 25 hours a week is not realistic for most people. More like 5 to 10, you know. And so the less time you have to study per week, the longer your test date should be out. So that's things that people don't play a role, and people don't factor in as far as their success. All right, seven, the last one, 777, is not having nursing fundamentals, right? So this kind of goes into what I was talking about earlier with abstract reasoning, but low nursing fundamentals. You need your nursing fundamentals. If you've been out of school for at least a year or longer, you need to brush up on patho. If you've been out of school for at least, I would say, um, a year or longer, but if you've been out of school for at least 5 years or longer, then you need to also brush up on patho and nursing fundamentals, which is different. So nursing fundamentals is like going over electrolytes, fluid electrolytes, imbalance, IV, but then a patho is going over what's the cardiac system do, what does the respiratory system do, right? So that's two different things. So a lot of issues for a lot of people, the reason why you're not remembering the information, the reason why you're not retaining it, is because you need to brush up on your nursing fundamentals. Like, it's like telling people to learn calculus, but they never first practice algebra. Like, you have to do things in phases and steps so it can really honestly work for you. And so that's why you need to go through your nursing fundamentals and like spend some time, dedicate at least a month. Everybody's different. Some people maybe need more time than that, but if you can, like, doing that, it will give you a lot of confidence. And here's a secret: it will help you with priority questions. Did you know that? It will help you if you go through your nursing fundamentals. You'll get stronger with also answering like priority questions, because priority questions are like, who do you see first? Well, think about it. How are you going to know who to see first if you don't understand how the disease process really works, right? So if I have one patient that has this disease process, another patient has this disease process, How would I really truly know who to see first if I don't understand, okay, this disease process is going to affect the respiratory system, which affects airway. That's why I see this one first. But then this disease process over here, this one actually affects circulation. So I'm going to see this one. I'm not going to see that one first. So when you learn some of these things, it really plays a role with your success. And you can, you know, do a bunch of strategies, do a bunch of questions, but I will say a lot of the people that I've talked to have already tried that and it hasn't worked. You know, they've already tried like 1,000. Like I remember one person I talked to, she told me for 3 months she did like 1,000 questions a month, and then she would print all the rationales off for like UWorld or something, and like print them out and read it and everything. She did like 1,000 questions for like almost 3 months, and she still failed her test. And so for me, that only proved to me it's not a like questions is not going to give you the full picture. You know, you're essentially just trying to take a shortcut, to say, for lack of better words, by trying to like memorize all the information without really understanding it. You know, so these are some of the things that you have to really like consider. You know, I know that it's not sexy to say all this, like like nobody wants to hear. No, Chioma, do not tell me this. What? Just tell me the 3 things I need to do right now, and in 6 weeks, and how I'll get my license immediately. Like, just tell me that. If I told you that, honestly, I wouldn't love you then. If I said that to you, I wouldn't be realistic. Because I would know what it would result in the long term, and so I want you to be fully trained, But I know it's a process. I know it's hard, I understand. Trust me, I get the level of frustration and the level of like just overcoming that in your spirit, man. I do grasp that. But there's a saying, there's a fairy tale that says slow and steady wins the race. Remember that? Slow and steady wins the race. Like the rabbit, what story was it? I think, oh, the rabbit and the tortoise, right? And so like the rabbit was like breezing, like, okay, let me like do some sprints, and then it got tired, and then I'm gonna take a nap. Man, the tortoise though was just going steady the whole time, right? Never took a break, super steady, and then boom, the rabbit woke up and the tortoise already was on the finish line in front of him because he was consistent, right? He was consistent and he kept on looking ahead. And some of you, that's what you need to do. You need to keep on looking ahead. You need to keep on believing that it's going to happen, but you have to put certain steps into place and you will pass. I promise you, you will pass. Like it is like proven. It's like it does happen, but the issue is that you need to go through the steps though. That's what it is. You need to go through the steps. What once one of my students I'm working on right now, she is so happy. She is so much happier right now that I'm tutoring, and she may be watching this right now, but she's so much happier because she said that like it's all beginning to make a lot more sense. Everything is beginning to click a lot more faster. And a lot of times when people come to me at the beginning, people are depressed. Like when I'm talking to somebody through a Zoom meeting, they're really depressed. They're like sad and everything. Like one student I worked with, she was so depressed. I was like, "How are you doing?" Doing okay. And then it's like, and I understand it. I get it, right? But 6 months later, now she's smiling though. She got her license now, working in a hospital and everything, right? After years of being out of school. So anything is beatable. You just have to know what you have to do and not get tired or weary in the process. All right. So let me just leave off a few other things. One thing I want to mention too, I mentioned for those that download the guide as well. If you want to be a part of our School of the NCLEX program, because in the program I do walk you through all of these things. Like in the program, like we go through different tests for you to take, to assess your skills, to assess your ability. Um, we even have a test that helps you to figure out if you have dyslexia. And then also there's different skills training, there's different standardized test study tips. We meet weekly. We also have live, what do you call it, one-on-one tutorings with myself. So I'll tutor you privately in addition to the group classes. And then also in addition to that as well, you get access to the portal for 9 months. So right now I closed the registration until January 2nd to sign up. But what I will do is that if you are still interested in it, if you send me a text, if you message me on WhatsApp, and what I'll say, I'll probably have to put it like this. I don't think I'll keep this video on here, but if you send me a message on WhatsApp, the number is 213-458-8963. 213-458-8963. Send me a message on WhatsApp and pretty much say live. And that pretty much means that you're interested in the program and joining the program, and I'll make an exception for you. But before you send me the message, though, the program is $2,000, though. So if you're not ready to make that type of investment, then just hold on for other things I have to offer instead, or save your money, right? Right now, that's the price right now, but it is going to be more when January hits. So if you are interested, or if you're on Instagram, send me a DM with the word live, either one, or you can send me through WhatsApp. If you don't want to do that, that's not for you, then the other option I have is our assessment program. So a lot of times people ask me, what's the assessment program? Can you explain what that is? The assessment program is a program that has the same components as what I just said right now. So pretty much it's self-study, so it's not like tutoring or anything like that, but it has the same components, meaning that it's trying to assess what your weaknesses are. It's trying to evaluate what you're weak in. And from there, once you figure out what you're weak in, everything from what categories, what type of areas do you struggle with the most, how does your education play a role in your nursing education, etc. In the assessment program, you'll take a test, RN or LPN. Once you take that test, it will also tell you as well, all right, here's a PDF guide, and I want you to go through and review these topics. So based on your test, it means that you're weak in these type of areas. So it will give you customized information to tell you what to study, what to review, what to learn. And then I have videos where I'm talking to you and I'm telling you, okay, here's the best way to learn pharm. Here's the best way to learn management of care. And it's called a transitional program because that's what some people need. You need to transition. You need to, really get back into the swing of things. And so it helps people in that regard. It also includes the Body Systems Crash Course. And the Body Systems Crash Course is where, what was I going to say? With that one, it's all about anatomy physiology. So that one, I go over all the 11 body systems with you. And then I also give you another training where I go over the basics of passing the NCLEX after failing before. And then it has content review, it has notes, it has slides, and everything from cardiac all the way to like how to learn pharm and etc. So the assessment program is a lower tier program, but it's for people who are like, I can't afford the live program, or you know what, let me just taste this first before I consider joining the mastermind program. So if you want to learn more about that, I put it on promotion where it's 50% off. So you can either do 1 year access, which is like $299 if you get the 1 year access versus $497, or you can do the monthly option. And normally the monthly option is $99 per month, but if you enroll now, it's $59 per month. So instead it'll be also as well 50% off. The coupon code is assess. I want to say it's assess now, but it's in the link in the bio if you're interested. And I put it for you guys here that's watching. If you're on Facebook or YouTube, just click the link that I pinned in the comment. If you're on Instagram, just go to the link in the bio and click that link. if you're interested in the assessment program. But if you're interested in the live review, then like I said, send me a message either on WhatsApp or on Instagram with the word live, and then I'll talk with you, and we'll go from there and see how I can best, help you. All right. I hope you found this helpful. Comment below if you found this helpful. Put yes, I learned something. Yes, this helped me. Yes, you opened my eyes in some way. Right? I hope that you learned something. See, and I hope that what I shared with you tonight was something that you probably haven't learned before. Let me ask you: have you ever gone through a training where somebody actually told you, here's how to learn. Here's some skills that you don't really already know. Here's some skills that you need to work on that you probably have forgotten about, or that you didn't realize were playing a role in your success. So if that's you, send me. If that's you, let me know if that really resonated with you, and if you really learned something from that. And if you're watching this on the replay, comment below. Replay, yes, thank you. I learned something. This helped me with X, Y, and Z, so that way I can know that you're watching this on the replay. All right, that's it. Have a wonderful rest of the day, and I'll talk with you guys very, very soon. All right, you're welcome.